Okay, so if you've ever felt that sudden, like, awful jolt of pain in your back,
Yeah.
that feeling someone just, I don't know, knifed you,
Oh, yeah. Horrible feeling.
then you definitely know what sciatica or chronic low back pain feels like. It can just stop you cold.
Right.
Whether it's a disc thing, scar tissue, maybe arthritis, a fall.
Or even just sitting too much. It happens.
Exactly. Or sitting all day.
Yeah.
So today, we're going to do a deep dive into some really surprising stuff from the sources you sent over.
Yeah, there's some fascinating insights in there.
Our mission really is to unpack how tiny, tiny pressures can cause huge pain. And then look at practical things like anti-gravity solutions and lifestyle tweaks that might actually bring some relief.
Right, because there are things that can help even if the cause is different for everyone.
Yeah, so no matter where your pain's coming from, stick with us. These are strategies that seem genuinely effective for finding some comfort.
It's pretty wild, actually, how such a big problem can start so small. Did you know that just 0.2 millimeters of pressure,
0.2? That's tiny.
it's incredibly small. Pressure on those really sensitive nerves in your back or spine can trigger major pain. One study showed it could ramp up pain by like 40% or even more.
40% from 0.2 millimeters.
Wow.
That's less than 2 credit cards thick.
Exactly. Almost nothing.
It totally changes how you think about, everyday stuff like sitting. We always hear sitting is bad, but this research says there's actually more pressure on your disc sitting than standing.
Yeah, it sounds backwards, doesn't it?
It really does. Could you unpack that a bit? Like, what's the hidden danger there that maybe even people who follow this stuff might miss?
Well, it's that constant kind of subtle squeeze when you sit, especially if you're slumping.
Which, let's be honest, most of us do.
Right, you lose that natural curve in your lower back, so the weight isn't distributed evenly, and it just compresses those discs. And it's not just sitting. Think about posture. Every inch your head drifts forward past your body's midline. That adds about 10 pounds of extra weight pulling on your upper shoulders.
10 pounds per inch.
Yeah, and that stress hits your upper back and your lower back. Then you've got driving long distances that can actually flatten or even reverse the curve in your lower back over time.
Wow. So it all just adds up, doesn't it? Sitting, posture, driving.
Yeah.
It all narrows that critical space. And then you mentioned age. We actually get shorter.
We do, yeah. As the discs lose hydration and compress over the years, that space naturally decreases.
So how does all that, compound together to actually cause the pain?
Well, all those things basically shrink the space between your vertebrae, right, and around the spinal column itself. When that space gets too small, eventually something's going to hit a nerve.
Ouch.
Yeah, and that's when you get the pain. So the real core problem you see is this ongoing compression, lack of space.
Okay, right. So if the problem is compression, lack of space, the solution has to be creating more space.
Yeah.
Which brings us to this anti-gravity therapy idea, specifically using an inversion table.
Exactly.
What does that even mean? Are you floating?
Not quite, though maybe it feels a bit like that. It basically flips gravity's effect on your spine. So you tilt backwards, maybe towards upside down,
Okay.
and you use the weight of your own upper body to gently pull downwards, creating traction on your lower back.
Okay. So your body weight does the work.
Precisely. And this creates what's called negative pressure in the discs. That's the key. It lets more blood flow in, helps break up little adhesions or scar tissue.
Right.
And the goal ultimately is just to increase that space by maybe the width of 2 sheets of paper.
Just 2 pieces of paper. That's it.
Often, yeah. That tiny bit of extra room can be enough to take the pressure off the nerve. It's amazing.
That really does shift perspective. And the research seems solid, too. Increased flexibility, lower risk of surgery for sciatica, pain relief.
Yeah, the studies are pretty compelling. Some show it works better than certain medications by like 35%.
Yeah.
And offers benefits kind of like cortisone shots, but without the side effects.
So if it's that good, why isn't everyone doing it? Or why don't doctors recommend it more?
That is a good question. I think that will be just awareness. And perhaps some doctors are cautious. But it is accessible. If you want to try it, the key is starting safely. Really gently.
How gentle.
Like first week, maybe just 1 or 2 minutes. A really shallow angle, maybe 15, 30 degrees, once or twice a day.
Okay, so definitely not going full bat right away.
No. Let your body adjust. Then, maybe over the next week or 2, you can gradually increase to maybe 5 minutes at maybe a 60-degree angle.
Got it. Slow progression.
Exactly. Then, after maybe 3 or 4 weeks, you could work up to being almost completely upside down, but only for like 2 minutes at a time.
2 minutes.
Yeah, and you'd cycle that, like 2 minutes inverted, then back to horizontal, then invert again. Do that for maybe 15 or 20 minutes total, maybe 3 times a week. They call it intermittent inversion traction.
Why intermittent? Why not just hang there?
That pumping action is really important. It helps push out waste products and pull in fresh blood and nutrients to the discs, like squeezing and releasing a sponge, you know? It gets circulation into those deep tissues.
Okay, that makes sense. And the cost? You mentioned it's pretty accessible.
Yeah, surprisingly so. An inversion table might cost, what, between $100 and $400?
Which is maybe 1 or 2 visits to a specialist or PT?
Exactly. So it can be a really cost-effective, long-term thing you can do yourself at home.
But there are safety warnings, right? You have to mention those.
Absolutely crucial. If you have high blood pressure, glaucoma, that's high pressure in the eyes, or any significant heart problems, you must talk to your doctor first. Seriously.
Okay. Doctor first for those conditions, good.
Yeah. Well, it's generally pretty safe for most people. Those conditions need a doctor's okay, no question.
Always check first. But for people who can use it safely, the feeling afterwards is described as like feeling taller, less pain.
Yeah, people often report feeling immediately taller, looser, like they just had an amazing deep stretch through their whole spine. Significant pain relief pretty quickly for some.
That sounds incredible. A real antidote to that knifed in the back feeling.
It really can be. But, you know, what if you don't have an inversion table? Or maybe that's just not suitable for you for whatever reason.
Right. Are there other ways to get some of that anti-gravity effect?
Yeah, definitely. There are things you can do at home using similar ideas. Like you can modify yoga's child pose. You can use some rolled up blankets or maybe a pillow under your torso. Prop yourself up a bit, let your hips sink back. It takes the direct gravitational load off your lower back, creates a bit of space, it gives you relief.
So it doesn't decompress like the table, but it gives you a break from gravity.
Exactly. It creates a low pressure situation, which can feel really good, especially when you're in pain. Another one is a wall-assisted leg up stretch.
Okay, what's that?
You lie on your back near a wall, and you use the wall to help lift your pelvis up, maybe one leg bent, one straight up the wall, or both bent. You gently lift your hips. It creates a sort of subtle inversion for the lower back.
Tilting the pelvis back.
Right. You can just hold it or gently rock. Then there's using a stability ball, an exercise ball.
How does that work?
You lie over the ball, face down, let the ball press up into your stomach and lower back area. Gravity then gently pulls your upper body down one way and your legs down the other. It creates a nice distraction, a gentle stretch through the spine.
Okay, using the ball's curve.
Yeah.
And what about just being in water?
Oh, water therapy. Yeah, that's huge. Being in water makes you buoyant, right? It dramatically reduces the effect of gravity.
Less weight bearing.
Way less. You can just float, gently move. It allows for gradual decompression of the lower back without the stress. It might not be as intense as an inversion table, but for sciatica, nerve pain, it can be incredibly helpful. Just being able to move without pain is a big deal.
Makes sense. So those are some good hands-on anti-gravity type approaches. Yeah. But the sources also talked about a more holistic view, right? Looking beyond just the mechanics.
Absolutely. Lasting relief often needs more. Diet comes up quite a bit. Specifically, a low-carb ketogenic approach.
Keto for back pain. How does that connect?
Inflammation. Keto is known to significantly reduce inflammation markers throughout the entire body. And chronic inflammation is often a big driver, or at least an amplifier, of chronic pain, including back pain.
So calming down the whole system can calm down the back.
That seems to be the idea. And related to that is eliminating certain fats, specifically omega-6 seed oils.
Like vegetable oil, corn oil, that kind of thing.
Exactly. The research suggests they can promote inflammation because they compete with the anti-inflammatory omega-3s in your body. Cutting them out helps swing the balance back towards less inflammation.
Interesting. Diet is powerful. What about supplements?
Yeah, a couple key ones were highlighted. Vitamin D is a big one.
Vitamin D for back pain.
Believe it or not, yeah. Vitamin D deficiency sometimes shows up first as lower back pain. It seems to play a role in pain regulation. The recommendation was pretty high doses, actually like 20,000 to 30,000 IUs of D3, but with K2.
Why the K2?
K2 helps make sure the calcium that vitamin D helps you absorb goes into your bones and teeth, not into your arteries or soft tissues. Yeah. It's important for directing the calcium properly.
Got it. D3 with K2. What else?
Magnesium. Specifically magnesium glycinate, around 400 milligrams. Magnesium is crucial for muscle relaxation and nerve function, so it makes sense it would help with back pain and muscle spasms.
Okay, D3K2 and magnesium, good nutritional support. And then there was stretching, but not just any stretching, myofascial stretching.
Right. This is about stretching the fascia, that connective tissue web that runs throughout your whole body. It's more than just, say, bending sideways.
How is it different?
Well, think about wringing out a wet towel or a rag. You don't just fold it, right?
You twist it first, then you squeeze or bend.
Exactly. You rotate and then you bend.
Yeah.
Myofascial stretching applies that idea to your body. So for the lower back, maybe you reach one arm up high over your head, really stretch it up. Then you side bend away from that arm, maybe even adding a little rotation into the stretch. You're using your whole body to stretch that fascial line, not just isolating one muscle.
Ah, like you're trying to wring out your side.
Kind of. It engages much more tissue for a deeper, more integrated release. Someone I knew described it like feeling their spine was being unzipped after doing it.
Unzipped. That's a vivid image.
Okay.
Okay, so wow, we've covered a lot. From understanding that tiny pressure to the inversion table and its alternatives, and then bringing in diet, supplements, and this specific type of stretching. It's quite a comprehensive picture.
It really is. It shows there are many angles to approach back pain. And what's really striking is how these seemingly small things can have such a big impact.
Yeah, that idea of just creating space, the width of two pieces of paper.
Right, or just shifting your diet by cutting out certain oils. These aren't necessarily massive, drastic changes, but they could potentially lead to profound shifts in how you feel.
It definitely makes you think, doesn't it?
Yeah.
To anyone listening, which of these ideas kind of clicks? What resonates? Maybe thinking about how you could bring one of these micro adjustments into your life.
Yeah, because sometimes maybe it's not about one giant fix. Maybe it's about finding those small, targeted changes that add up to real comfort and relief.
A powerful thought. Focusing on those small adjustments for potentially big results.